Hello, future nerds, and welcome back to this video lecture series on infectious diseases and communicable diseases. The communicable disease that we are going to present is one of the really dangerous, deadliest communicable disease so far, and we need really to be aware of this disease also. So what I'm talking about is meningitis. Okay, and meningitis is the inflammation or infection in relation to this topic of the meninges. Okay, as you all know in your anatomy and physiology, and speaking of anatomy and physiology, I suggest that you also go back to your unofficial lectures and study about meninges or the brain as a whole. Okay, and okay, so the anatomy and meningitis is an acute contagious disease due to inflammation of covering of the brain and spinal cord called the meninges. Okay, so there are different microorganisms that cause meningitis. One is fungal meningitis, cryptococcal meningitis, meningococcal meningitis also, usually caused by a bacteria, and this is considered by far the most fatal. Okay, the vascular system is affected, and again, it is stated that it's highly contagious. Okay, and that bacteria is Neisseria meningitidis. Okay, and this is again caused by Haemophilus influenzae, Streptococcus pneumoniae, to name a few. In some other references, they also include Mycobacterium tuberculosis. So usually this the start of this is when an infection reaches the bloodstream and it reaches the central nervous system, particularly the brain. Okay, that's one of the primary reasons to have meningitis. Okay, usually the disease begins as infection from a normal flora. Okay, and for example of normal flora, based from what I have mentioned, microorganisms, Haemophilus influenzae is from the ears, which can cause otitis media. Streptococcus pneumoniae for the uh, in the lungs. Okay, it can cause pneumonia. Streptococcus group B and Neisseria meningitidis, and also H. influenzae can cause upper respiratory tract infections. What else? We have Staphylococcus aureus can cause subcutaneous tissues and skin infections. Also, bones, infection of the bones, E. coli in the intestine. Okay, so these microorganisms are also identified in some cases. The known reservoir, okay, the only known reservoir for uh, meningitis or the Neisseria meningitidis is the human nasopharynx. It has an incubation period of 2 to 10 days with average of 3 to 4 days, and it is transmitted through droplets. Clinical manifestations in general can exhibit fever, tachycardia, respiratory arrhythmia, soreness of skin and muscles, convulsion or seizures, headache, irritability, fever, again, neck stiffness or nuchal rigidity, pathologic reflexes, Kernig's and Babinski reflex, and also Bunsinski reflex. So I think you are familiar with this reflexes um, in your health assessment subject. Okay, and the pathognomic sign of or characteristic sign of meningitis is a Waterhouse Friedrichsen syndrome. Okay, this is caused by adrenal gland failure due to adrenal gland bleeding, and usually the manifestations is um, a rapid development of petechiae or the pinpoint rashes, uh, leading to purpura to ecchymosis plus shock. And this purpura is usually not really pink or red but black because it involves bleeding. And this purpura petechiae is usually found in the extremities. Okay, I think I have a picture here which I can show in this presentation later. Diagnostic exam is primarily we have two. One is lumbar tap or lumbar puncture, which you have to extract cerebrospinal fluid or CSF and elements from the CSF, which would give a definitive or high chance of diagnosing meningitis is it has increased WBC, increased protein, and decreased sugar. So this is also diagnosed with blood culture to determine what microorganism is present or may be present in the blood. Okay, so uh, it is when just in additional information, we say lumbar puncture. Usually, this is done to obtain specimen out of CSF. Also, it is used to reduce increase intracranial pressure, as I say, uh, to introduce medications can be possible, and to inject anesthetics. I think I have also a an image here, okay, which I can show later. Medical management is antimicrobial agents. We have several ones. These are really strong um, medications, antibiotics. We have cephalosporins, beta-lactam, antibiotic, and since these are antibiotics, which are usually prone for allergies, so monitor for allergic reactions, PT and platelet monitors for super infections, especially if there is a opportunistic infection or secondary infections due to decrease or suppressed immunity. Then we also have vancomycin, glycopeptide, antibiotic, monitor blood count, BUN, creatinine, and blood drug levels. Okay, we also have sets of penicillin. Okay, then we have amikacin in the presence of gentamicin. It's aminoglycosides, and we have steroids as anti-inflammatory agents, osmotic diuretics to decrease CSF fluid or excess fluids. Then anticonvulsants, which is with the use of dilantin. Of course, the manifestations also depend on what part of the brain is infected. Okay, so nursing intervention aside from the treatment that I have mentioned, uh, we should observe standard precaution to prevent disease transmission because it's highly contagious and really fatal. Um, Administer antibiotics with strict administration schedule, so meaning that should be followed religiously. Then we have a provision or rendering tepid sponge bath as necessary. Administer antibiotics as prescribed. Provide mouth care and lubrication after seizures, if ever there are episodes. Roll the patient to the side or semi-prone to facilitate gravity in draining the secretions. Okay? Because usually after seizure, saliva or secretions tend to pool in the mouth, and you have to train that to prevent aspiration. Then, if at least for aspiration, suction is as needed. Reorient to environment as needed, because there are cases, or most of the cases of seizures lead to disorientation, okay, or temporary amnesia. Reduce noise environment. This is to keep the patient calm and this to prevent stimulating seizures. Keep the patient's room darkened and ask family to bring sunglasses or shades for photophobia. Encourage fluid intake as appropriate. Some patients may need IV infusion. Uh, Monitor infusion sites for complications or complications of IVT. Then provide explanations of disease, process, and management. Um, Explain it the simplest way possible for the family and even the patient can understand. Okay. If patient is to be discharged with medications, provide written instructions for reference at home. I think that's routinely done for as part of discharge planning and discharge instructions. Okay, so also in addition, the one of what's this one of the practices should be preventing occurrence of further complications. Maintain strict aseptic technique when doing lumbar puncture, because it's invasive. Okay, so we do not want to be the cause of infection. Then early signs and symptoms or manifestations of any other problems or the present problem should be recognized. Then, of course, vital signs monitoring. Then, observe for signs of increased ICP. Um, Usually, for vital signs, increased ICP is manifested by increased BP, increased temperature, decreased respiratory rate, and decreased heart rate. Then again, for photophobia, protect the eyes from light. They can use shades, also prevent noise so as not to stimulate seizures. Maintain or increase as needed fluid and electrolyte intake or balance. What else? Check for signs of dehydration. That's why you need to maintain fluid and electrolyte balance. Of course, prevent the spread, okay, since it's contagious and really fatal. And then one way of prevention is uh, disposing of secretions properly. Importance of the use of masks. Okay. Um, Isolate the patient, of course. Um, Of course, also when seizure occurs, prioritize safety. Can lower the height of the bed, raise side rails. Again, prepare tongue depressors and reorient the patient when once recovered from seizures. Just additional signs and symptoms. We have headache, photophobia, body malaise, irritability, chills and fever, vomiting, seizures, or decrease of level of consciousness or LOC, PTK and ecchymosis on wrists or in ankles, just like what I've said. This is uh, the site of the rashes or your PTK. It's usually found in the extremities, okay, and it's one of the signs of the pathognomic sign. Uh, okay, just a continuation of the assessment and manifestation is the presence of nuchal rigidity, Kernig sign, and pain in the Kernig sign is a pain in the hamstring muscle when the hip is flexed. We have also Brzezinski sign, flexion at the hip and knee in response to forward flexion of the neck. Okay, so these are reflexes and these are abnormal reflexes. These are danger signs actually. These are signs that there is something wrong with the brain. Okay, in case ICP, then if it's an infant, there is high pitch cry, bulging of the fontanelles, and possible hydrocephalus. Okay, this is an image of Brzezinski when you flex the neck. Okay, the knees, the hip will flex. For Koenigs, there is a pain in the hamstring. Okay, when in the hamstring, when the hip muscles is flex as presented earlier. Okay, so just to list some nursing diagnosis. Okay, other nursing diagnosis related to meningitis, and I know you have been asked several times, okay, to make or to formulate a nursing diagnosis as part of being a student. Complications, again, it also depends on the part of the brain affected, but in general, the patient may have hearing loss, mental retardation, paralysis, brain damage, coma, and even death. Okay. So just some images related to meningitis, and this one is in relation to lumbar puncture. That is the position of the patient, of the client. It should be a fetal position to really expose the lumbar area. It is the CSF is extracted between two vertebrae and it's in the lumbar area. So if the patient is to be evaluated after the treatment and the nursing interventions, the temperature should be normal. Okay, there should be relief of pain. There is self care activities. Then the fluid and electrolyte is balanced, and there is complete understanding, okay, of the disease. Patient does not have seizure activities. Patient maintains optimal tissue perfusion, and it has a good Glasgow Coma scale. Patient appears comfortable, and patient and significant other can discuss present infection and management. So this is to gauge if the patient understands the health teaching given to them, especially when it comes to level of knowledge. This is very important that the patient and family members understand, okay, the case or the situation of the patient, not only for meningitis but all other infections, all other diseases. It's always a must that families and patient or patients should be involved in the treatment regimen. Okay, so I hope you learned something for today's presentation, meningitis, and hope to see you in the next video lecture. God bless, future nurse, and thank you for subscribing.